I'm Dr. Dean St. Mart, formulator for supplement needs, and in this video we're going to discuss liposomal glutathione. So what is liposomal glutathione? Or more specifically, what is even glutathione? Glutathione is the key master antioxidant within our body. It's involved in phase 2 conjugation reactions. So what's phase 2? You may have watched the liver stack video where I discussed a little bit about liver metabolism. But specifically, phase 2 metabolism within the liver is a biological process that conjugates a water-soluble substituent to perhaps a toxic molecule to make it more water-soluble so that it can be excreted in your urine. So by making it more water-soluble, it's more readily to be excreted. Now, when we look at our environment, so either pollution, exposure to plastics, exposure to pollution in the air, exposure to certain compounds you may ingest, even paracetamol, all these compounds can deplete our glutathione due to how it's used up to conjugate specifically toxic metabolites for excretion. Now you may be familiar with N-acetylcysteine, NAC, which is a sulfur donor by providing cysteine to our body in order to help create glutathione. So glutathione is a molecule that's composed of cysteine as well as other amino acids. So we specifically need to ensure that we're getting adequate cysteine within our diet to ensure that glutathione recycling happens. Because when we use up glutathione in our body, it doesn't actually leave our body, it gets recycled. By using liposomal glutathione, we're helping to ensure that we always have adequate stores of our reduced glutathione so that again, that's what's there ready to use by the body. Now, what is a liposome? A liposome is a nanoparticle, more specifically a phosphatidylcholine complex. Now that sounds crazy and very scientific. What it is a small fat-soluble molecule. Again, more specifically, nano-sized. This means that it can get incorporated into your cell membranes in order to enter into your cells directly. As you know, the outside of our cells all have this phospholipid membrane, so we need something that's fat soluble to pass through that membrane, and that's what a liposome is capable of doing. Again, we emulsify through the manufacturing process glutathione into the liposome so that when we ingest it, it does that process. Now with our liposomal glutathione, we've chosen specifically the patented form known as Cetria. This again guarantees the quality of the glutathione. When we look at glutathione as a supplement, it often gets a bad name within the fitness industry because oral glutathione does in fact get hydrolyzed in our stomach and is pretty useless at increasing glutathione levels within the body. However, on the reverse, there is literature there to support liposomal glutathione increasing intracellular glutathione stores. Now, most people are probably familiar with IV glutathione. So intravenous glutathione is often used as either a cosmetic procedure for lightening the skin, or again to help directly replenish glutathione stores in the body. However, again that brings with it side effects towards skin lightening at the site of injection for the intravenous infusion. Liposomal glutathione is taken orally and has nearly the same bioavailability as intravenous. So again, it's a very easy way for boosting our intracellular glutathione levels. Now, how can we assess our glutathione? If we look at our blood work, we have a marker known as GGT, and that's called gamma glutamyl transferase. That's a direct correlation to our glutathione recycling within the body. Ideally, we want that level somewhere between 16 and 20. Too low, and we have too low levels of glutathione, and too high, again, we're not keeping up with the rate of glutathione recycling. So 16 to 20 within the literature seems to be the sweet spot. And again, this can be a nice predictor for cardiovascular disease risk because it can show potentially underlying inflammatory processes. So that's liposomal glutathione. I hope it gives you a better understanding of why we've developed the product and why we've specifically chosen that over some of the other forms that are on the market. I'm Dr. Dean St. Mart, formulator for supplement needs, and thank you for listening.